Thank you, Mr. Speaker. I think my perspective might be a little bit different. In fact, when my colleague was speaking about physicians, I'm sitting there thinking, I am a physician. And not only am I a physician, but I've actually been working to treat the uninsured for the last 20 years. I mean, my practice has been for the uninsured. And so it's a little bit different. And one reason that I ran for office is I was frustrated with the way that politicians always dealt with health care. It is a truism. Politicians overpromise and underfund. We can see that with Medicare going bankrupt in 7 years. We can see that with Medicaid bankrupting states. And I saw that in my practice because everybody would be promised these benefits, and when in my practice I could not get them for them. Inevitably, quality and access suffered. But we're told now is different. No, believe us this time, we're going to adequately fund. We're going to adequately fund by taking $500 billion from Medicare to create a new entitlement. Wow, we're really doing a lot for Medicare there, aren't we? We're going to expand Medicaid. Medicaid, which is bankrupting states. So now instead of somebody having no insurance and being unable to see a physician, we're now going to give them Medicaid, but we're going to have to decrease payments so much that we're going to raise taxes, costing jobs, and they still won't be able to see a patient. I say that because the New York Times had a heart-rending article about a woman on Medicaid in Michigan, and payments are so low she can't get cancer treatment. When I hear we're taking care of the 31 million people without insurance, I think of that woman on Medicaid in Michigan with a government-funded, with a government underfunded policy with which she cannot gain access. If that is morality, we must have a different definition of morality. It is morality for show. It is not morality for reality. Now, there are alternatives. And another frustrating thing about this debate is that we know what works. We can look at Massachusetts, where they attempted to expand access.
You can have another minute? 30 seconds? 2 minutes?
1 minute. 2 minutes.
1 minute. 1 minute.
Gentleman's recognized for 1 minute.
Where in Massachusetts, they attempted to expand access and control cost. That's this plan. And what we just heard in Massachusetts is a Democratic treasurer saying this plan will bankrupt our nation in 4 years. Alternatively, what we can also say is that we know it works. The Kaiser Family Foundation did a study in which they found that health savings accounts lowered costs by 30%, and that 27% of people with health savings accounts, 27% of people with health savings accounts were previously uninsured. By lowering costs, we expanded accesses. We know it works. The plan they proposed has already failed. The plan that we propose, there is data to show that it works. Now, we can talk about the Congressional Budget Office report that supposedly saves money. 10 years of tax revenue for 6 years of big government programs, that's a savings. Or in 2018, it saves money by pushing the cost of Medicaid out onto the states. That saves money. In my state, first 3 years that we're responsible for the... Can I have 30 more seconds?
I will give the gentleman 30 more seconds, and does that leave me 30 seconds, Mr. Speaker?
That is absolutely correct. The gentleman's recognized for 30 seconds.
Thank you, Mr. Speaker.
In my state, the first 3 years we're responsible for these additional costs is going to cost my state $600 billion, $600 million. Well, that's a savings to the taxpayer. Now it's just the state taxes that are going up instead of the federal taxes. Now, there are bipartisan solutions. I challenge my colleagues. Let's take a break. Let's go home Sunday and Monday and Tuesday, come back Wednesday. Let's have a town hall meeting, each of us in our district, hear from our people back home what solutions they want to see, and come back and vote on Thursday. Somehow I think that these people who are on the bubble will learn that they should be representatives. They should be learned to be representatives and not dictators. Thank you.
Gentleman yields. Gentlewoman reserves balance over time.